Hey guys, welcome back to the Dent Life. My name is Komal, and in this video I'm going to be talking about the E-Portfolio in dental foundation training. This is something that baffled me when I was not a dental foundation trainee. I heard about this thing called the E-Portfolio, had no idea what it was, probably until even after I started dental foundation training, I was a bit confused by it. Now I'm getting the hang of it, so I thought I'd make a video and tell you what an e-portfolio is. So this video, again, it's not me just talking at you. I'm going to be sharing a screen over here and I'm just going to go over the e-portfolio a little bit. E-portfolio is something that you have to do as a dental foundation trainee. You have to keep on top of it. It's just good to keep on top of it because the work's just going to catch up with you. And the way it's set out is actually really good. There's nothing that you can miss because there's a to-do list right there. All you have to do is do it. And it's not something that you know, when you don't know you're supposed to do something and then suddenly you're like, there's literally monthly, you have tasks that you need to complete and it's cool, it's straightforward. So let's go on to here. I have some overdue items, so don't look at those. So September is when dental foundation training starts. So here we have basically everything I did during induction. So you have the learning agreement, it's basically agreed that I'm gonna learn stuff. Foundation and my details, my values and expectations. So I have to write about what I expect from the year, what I want from the year. We have induction to the practice and induction to clinical practice, and it says what's on the tin. So it's just an induction of literally A to Z, everything in the practice, like how to greet patients, to the fire safety, to what instruments we might have in the practice and how they're decontaminated, what are the rules on radiology, like basically everything in the practice you get introduced to. And then you have Pre-Dft clinical experience review, and that is something I did show you guys in one of my vlogs that I made. It's basically everything I did before DFT. So how many checkups have I done before DFT, how many crowns, bridges, dentures, fillings, amalgams, composites, blah 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 did I do before DFT, basically just to know where I'm at. Then we have DOPS, which is direct observational procedural skills. So we had to do a new patient examination and a simple restoration. That is basically when our supervisor watches us do something and then grades us on it to say that we're capable of doing something by ourselves. So just they have to see that we can actually do stuff before they let us do stuff. And then non-working days log and clinical experience log. Then in October we had an early stage review, and so I write a report on how I feel everything's going, and then my ES writes one, and so does my TPD. And then every month you also have to do a clinical experience log. So that's basically a list of clinical activities, and then you say how many you've completed in that month. And then you also have the non-working days log again. In November I had to do a records review, so make sure you're doing everything properly when you see a patient. So are you doing a BP? Are you taking radiographs? Are you checking the soft tissues? Are you checking the medical history? Are you writing your notes properly? Are you gaining consent, telling the patient about the price that they need to pay? And then of course you have your clinical experience log there as well. So every month you just do a clinical experience log. In December we have patient satisfaction questionnaire, and that is basically something you give to your patients to anonymously answer about you. So they basically rate you on how well you're doing in terms of your communication, how welcome you made them feel, how you explain things, did they feel at ease with you. And then you have a multi-source feedback questionnaire, and this is something that you probably did at university as well. It's basically where your colleagues let you know how you're doing. So they will say if you're professional, if you're on time, if you're a good communicator, if you work well in a team, things like that. And then in January, we're starting to reach our halfway point. So we're doing things towards the interim review. And that is basically a few audits, some practice meetings, uploading some cases, just a bunch of stuff you have to do in the middle of the year. And then you're told about your progression, like what you need to improve, what you're doing well for the rest of the year, to enable you to gain that performer number at the end of the foundation training year. Then in February, we actually have nothing on the to-do list because we're still doing the interim review. It lasts until about March because that's 6 months from when we started. In March, again, same thing. April, same. May, the same. And then in June we have our final review. So that is basically coming towards the end of the foundation year. They're just checking on you, making sure you're doing everything properly. There isn't anything that's concerning now, because you've only got 2 more months left as a foundation dentist. If something's concerning, you need to work on it ASAP, otherwise you might be in trouble towards the end. And here you have to meet a certain amount of UDA targets, you have to meet a certain amount of things that you have to do, for example, a certain amount of crowns, certain amount of dentures. So it's similar to dental school, where you have to meet these targets, and then you have a progression report written by your educational supervisor and your TPD. Then in July, just the clinical experience working log, and same in August, because your final review is done, and then you have the 2 months to kind of make up for everything that's outstanding, meet all the targets, basically get through the year. So that is the to-do list, the learning schedule as it's titled. And then we have feedback. So feedback area, it tells us the patient satisfaction questionnaire and the multi-source feedback questionnaire. That's something that's happening at the moment. And then we have a clinical supervisor report, placement report, and simulation learning exercise report. So lots of reports that people do for you throughout the year. And then we have the portfolio documentation. So ADEPs are similar to DOPs. ADEP stands for a dental evaluation of performance tool. So this is where you carry out a few treatments and your educational supervisor watches you do them or helps you do them, and then feeds back on how you did them. Then we have case-based discussion. So check out my video on case presentations. That's similar to what this is. Every month you take out an hour or so to present a case to your supervisor, and you basically go through all the steps that I went through in my last video and get feedback. Just it's a learning process basically. So DOPS we went over, and it's basically the supervisor observes you doing something. We have to complete 6 in the year, so it's stuff like initial exam, simple restoration, a surgical extraction, things like that. Then we have learning and development needs, so it's basically just what you feel or your supervisor feels that you need to develop more on. So you write a target down. So I need to develop my occlusal analysis, and I'm going to do this by October 2020. And then when I've done it, I'm going to go on here and I'm going to write about the fact that I've completed it, when I completed it, how I completed it. It's just measuring your progress. Then you have reflections, and this is big things that happen in your foundation year that you reflect on. So for example, I was redeployed, I was on a hospital placement in 2020, so from September to December. I went to a hospital once a week and I did some stuff there, so I reflected on that. So then I've got reflections on tutorials. So once a week you have tutorials with your supervisor. So it's basically like a one-on-one session with your supervisor, and you just discuss the concepts, you discuss papers, you discuss opinions, just everything. You can discuss cases that are relevant to the tutorial, and then you reflect on the tutorial that you've had. Then you have reflection on study days. So once a week we have study days. At the moment they're either virtual or in person. If they're in person, there's only a few of us there because we have to maintain social distancing, etc. So recently I had a study day on replacement of gaps. For example, we talk about dentures, bridges, implants. There are phantom heads where you can practice the things that you learn. So we practiced bridge prep, and then I have reflected on that over here. Then you have uploads, that's just basically documentation that you need to upload. Then you have project presentations, audits and surveys. That's quite self-explanatory. Then you have a personal development plan, and this is something you also do at university. You've probably seen this before. Everything you do at university sets you up for this stuff, and then this stuff sets you up for real life. GDC has these aims that they want you to meet. So there's A, B, C, D. I'm going to put an image over here because I'm not very good at explaining stuff. You just have to set up a plan, and you say which GDC aim you're going to meet through this plan. Records review that we talked about before. Then you have reports, so assessment scores, clinical competencies, basically all the things that you are judged on this year. It's all down here. Induction, that's obviously already done. Then you have logs, so the clinical experience log, complex treatment, if you carry out any complex treatment, you log that here. Clinical activity log, significant events log, complaints log, non-working days log, CPD log. CPD is something you do for the rest of your life once you're a dentist. It's continued professional development, and to be on the GDC register you have to do a specific amount of CPD in a 5-year cycle, or every year you have to do a specific amount. So you log it over here, and you also log it in your GDC website area. Invitations log, I'm not actually sure what that is, but anyway. So then we've got the early stage review, interim review, and the final review, and then a checklist for the progression. So literally everything is on here. Like, it couldn't be any more clear than it already is. So it's really, really nice to have everything just laid out for you. So I know e-portfolio just sounds really confusing when everyone talks about it. They talk about DOPs and ADEPs, and you're like, what the heck is that? But it's literally so straightforward once you log in. If you take all of this off and you do a good job in your dental foundation year, you're gonna get through it and it will be fine. So I know e-portfolio sounds really scary when you're a dental student. You're like, what is that? It's like a mystery. I don't know what it is. I just don't know. And I have had a lot of emails like asking me, what do you do in foundation training year? Like, how does it work? How do they monitor you? You know, this is how they do it. I hope that answered all your questions and it myth busted everything. If you have any more questions, feel free to email me, DM me, drop a comment below. Make sure you subscribe to the channel, check out thedentlife.com. I hope you enjoyed the video, and I'll see you again in the next one.